There's obviously political challenges involved in a distribution of vaccines, and many countries that made a lot of commitments sounded great in a soundbite, but in reality, when it came time to it, people were concerned about their population first. And then it was, okay, now what do we do to help someone else?
Hello and welcome to Comms Life from APCO Worldwide. I'm your host, Tom Billinghurst. Every episode, we take a deep dive into the topics and trends shaping the communications industry and beyond. In this episode, we're looking at how vaccines are being distributed around the world and the challenges that logistics companies face with getting the medicine to where it needs to be in time. Set against a chorus of global calls to ensure that vaccines are shared fairly to developing economies so they can recover at a similar pace as developed economies, there's pressure on the companies integral to distribution efforts to ensure that they are doing their part to help vaccinate the world and not just the richest parts of it. So how do you go about executing and communicating this unprecedented global effort? Joining us to discuss this, the topic of our time, is Craig Arnold, Vice President at UPS Healthcare. Craig, welcome to the show.
Thank you, Thomas. Very glad to be here.
Thanks so much for taking the time to join us from Atlanta over there in the US. Craig, before we get stuck into it, can you tell us exactly what the Vice President of Healthcare at UPS does?
Yeah, absolutely. My specific role is in revenue generation outside the United States. So I'm responsible for everything but the US in terms of delivering that top line revenue for the organization. UPS Healthcare has been in existence a very long time as a separate division within UPS only since January of 2020. Leading up to January 2020, there had been a plan for a couple of years to create a division within UPS or a company within a company for healthcare. And that's important because it gives us some autonomy to make very quick tactical and long-term strategic decisions. And it just coincided with the start of the pandemic. So it's actually been a very good time for us to be in that position. We have over 5,000 healthcare dedicated professionals who are trained in healthcare quality systems, as well as many different disciplines within the healthcare logistics arena. So that's sort of the day job. I'm also very much involved with the UPS Foundation. So I spent some time in the Philippines, in Tacloban after a cyclone, and Vanuatu and Puerto Rico and the Virgin Islands. And I think that experience right now of disaster response tied into this healthcare division and the global nature of it really put me in a very interesting place. And I feel very blessed to be in a place where I can be used and be very much involved in the response to the pandemic.
Absolutely. It sounds like a very timely confluence of factors coming together at the right time. Okay, so let's focus on how important the global logistics and supply chain and related sectors have been. They've always been vital, obviously, but in the last 18 months, how important they have been in ensuring equitable vaccine distribution to all parts of the world. There have been many, many challenges, but I wonder if you can highlight for us what the main challenges have been, how some of them have been overcome, and which remain.
Sure. Yeah. A couple of things happened during the pandemic. The first thing was the desire and the need to move large amounts of PPE. People needed masks, they needed gloves, they needed gowns in hospitals, and getting that outbound from Asia in the beginning is an extremely challenging thing. We had a large amount, 254 charters actually in 6 weeks, which is a lot of dedicated aircraft just full of those very important vital items for the healthcare community. And then right after that, it turned to clinical trials as these vaccine manufacturers were getting to the point where they had an idea that now was being tried or being worked on with people involved in those trials. And again, the importance of getting that very right thing to the right people at the right time was extremely it guided what we brought to the table for our customers and the healthcare community. And then now that's transitioned into vaccine distribution. And that vaccine distribution, there's obviously political challenges involved in the distribution of vaccines. I think globally, there's a number of key stakeholders that made very large commitments about moving things in an equitable fashion. But yet, at the same time, most countries act with self-interest first. And that's a reality. If you look at, you see that all over the world. And many countries that made a lot of commitments sounded great in a soundbite, but in reality, when it came time to it, people were concerned about their population first. And then it was, okay, now what do we do to help someone else? I think that probably the biggest overarching challenge would be the need for ultra cold for the mRNA vaccines. So Moderna and Pfizer at -20 C and down to -80 for Pfizer. That created an extremely challenging situation for countries that don't have that infrastructure. Most countries don't have freezer farms with large capacity to hold -20 or -80 or -70 vaccines. So that idea of what do I do when I get a mass shipment of millions of doses into a country of frozen vaccine that needs to stay frozen, most people, many countries, I should say, were scared off of those early vaccine successes that we were seeing with Moderna and Pfizer, and tended to go to a 2 to 8 vaccine. And I think what we've seen and had a lot of conversation with countries and ministries of health about is you don't need to think about moving millions of vaccines at a time into large freezer farms in capital cities around the world. What we need to be thinking is just-in-time supply chain, and just move what you can take in that 10-day pack out with dry ice from the producer location. Only take what you can import into the country and deliver fairly quickly. But this idea of massive investment in these freezer farms, it scared governments off. And that was a shame, because as it turns out, those vaccines really have done better at the beginning than some of the other vaccines. And that, I think, has caused some challenges for us.
It's a really interesting, a couple of things you said there, really interesting. Firstly, from a communications perspective, you said that some of the rhetoric surrounding the political challenges sound great in a soundbite, but in reality, countries will act out of self-interest. How difficult or challenging has it been for a company like UPS to manage expectations of leaders who, when they say something, will affect the confidence of markets and consumers and obviously the economy? How have you sought to strike that balance between this is what we can deliver and you need to offer a message of hope?
Yeah, I think that's a great point. And that really is the message. It is, here are solutions, here are ideas, here are things that we know will work, and things that have been tested. And by the way, we may need to tweak on the fly. That's part of a response to something as critical as the pandemic. So there has to be a constant communication on what's working. So far, as an example, just within the company that I work for, we've delivered 300 million doses to 92 countries with no temperature excursions. And a large majority of that is ultra cold vaccine. So that there is a way forward. It's not easy. It's not normal. It's not what we've done 2 years ago in moving vaccines. It's a different thing, but it is possible. And that's the way we need to think. And we need to concentrate on what's working, learn from the things that don't work, and move faster.
On the other end of the spectrum, you have some countries who, after their vaccine rollouts, have now accumulated something of a vaccine surplus, which is, the other challenge that is being faced. So as these excesses continue to contribute and affect the available supply of vaccines throughout the world, from a policy perspective, what would you be advising government leaders to make sure that this is addressed and that there is an efficient amount of supply available for everybody?
Yeah, I think that's a very good point. And we're starting to see that already, right? You're seeing two things. You're seeing private companies making commitments to help the equitable distribution. As an example, Pfizer committed 2 billion doses to lower and lower middle income countries globally. So that private sector move, combined with things like, and this is a US centric example, but the Biden administration has made commitments as well to move millions, hundreds of millions of doses to lower and lower middle income countries. Those things together will help drive us where we need to be to get equitable distribution. When you have both private enterprise as well as the public sector moving together, and when you bring that together with good communication, with an understanding of what's expected and who's bringing what to the table, that's where I think we see the unlocking of real value in the supply chains.
Despite some of these vaccine surpluses, the rollouts in some countries, the US, the UK, and even here in the UAE, their vaccination drives have been immensely successful and some of the best percentage of vaccinated per capita in the world. So I guess on the back of that previous question, how can the programs that were rolled out in those countries be adapted to the needs of the developing world?
Well, I think there's definitely the role of communication in building trust in vaccines, regardless of where the vaccine comes from or who produces it. Listen, people need to know that there is a way forward, and together we've come up with the right solution to move forward, and this is what that is. I think that's a very important part, and getting everyone to understand the goals of that joint effort, and then what the steps are, and being open and honest in the communication as you go forward. I think that's the way to get confidence levels higher and to get more vaccine flowing.
Thanks for tuning into Comms Life by APCO Worldwide. If you're enjoying this, subscribe to our YouTube channel and follow us wherever you get your podcasts from. Catch up on all our previous episodes where we discuss everything from the future of aviation with Arabian Aerospace to the global economic recovery with The Economist.
Welcome back to Comms Life from APCO Worldwide. We are still here with Craig Arnold, the Vice President of Healthcare at UPS. Craig, for the second segment of the show, we want to look at a recent news item to further our discussion and perhaps drill down a bit more into the communications and media landscape on the topic that we're looking at, which is the vaccination drives and the logistics and supply chain effort that's gone into getting vaccines around the world. Now, the news piece we're looking at here was on the BBC in May 2021, called COVAX, How Will Vaccines Be Shared Around the World? For the sake of listeners, I'll read out some of the key quotes from here and then come to you to get your thoughts on them. The article says, an international effort known as the COVAX scheme was set up last year, so that would be 2020, to try to ensure fair access to vaccines among rich and poor nations. But the global situation remains vastly uneven. Dr. Tedros, the WHO Director General, has criticized wealthier nations for undermining COVAX, accusing them of gobbling up, that's a quote, the global vaccine supply by ordering multiple times more than they need for their own populations. He said in April that only 0.3% of the vaccines administered around the world so far had gone to people in low-income countries. Now, Craig, coming to you here and looking at this article from a communications perspective. To begin with, I guess these stories will always make headlines, right? Negative or bad news is read much more assiduously than good news, especially when we're talking about societal inequalities. But let's look at this then from UPS's perspectives. And we've discussed some of the challenges that you've had with communicating the work that you've done to ensure people are aware that vaccine distributions are fair and equitable. But how do you translate that communications effort into media coverage that is fair and objective and telling it as it is?
Yeah, that's a good challenge. I think the way that we've done it and the way we've been successful so far is there's a few key parts to a good communication strategy. One is you need to have a good story to tell. And I think UPS does. We've delivered vaccine in 92 countries. And then how do we get that message out to our people and to customers as well as to the general population? I think it starts with a strategy around why we're taking on the efforts that we're taking on in terms of equitable distribution going to, as mentioned, so many countries. I think that's an important piece, and people need to understand why UPS thinks that equitable distribution matters. And then there also is part of that strategy is that people need to understand that we don't decide who gets the vaccine ultimately. At this point, it's still largely governments making those decisions.
Yeah, absolutely. This would have been an absolute whirlwind for, well, it has been a whirlwind for everyone that's been affected by this in professional circles. I imagine the impact that it's had on you and your professional career has been quite incredible. I wonder if you have something that you take away as this major learning curve since it's been all hands on deck at UPS to get vaccines across the world.
Yeah, I think, and this is somewhat tactical, but one of the things that it took me a little bit to understand in the beginning was that this was a marathon, not a sprint. And it feels like we had this massive sprint to the starting line of a marathon. So we were at full sprint, and then we looked at it and said, hold on a minute, this is going to be years, not weeks. And some of what we put ourselves through and put our employees through and employees' families through in terms of hours and what was expected of them, we needed to balance that out a little bit and just say, wait a minute, this is not just a couple of months of, everyone globally is just going to hunker down and really get stuff done. It's not going to be that. It's going to be that plus a lot more. So we have to think about how we impact our people. Another thing that I think I would take away is that when our organization, and this sounds common sense now, and it sounds almost silly to say, but when everyone is behind something that's bigger than themselves, it's amazing what that level of commitment looks like and what can be done on the other side. And when you don't realize what you don't have until you really see that. And when you see that massive jump in the commitment index, to me, just shows that our people feel like they're part of something really cool. And I guess the challenge for me as a leader, and personally, is how do I get that? How do I sustain that and keep that during a pandemic and post-pandemic and pre the next one, right? How do we keep that in the peacetime, if you will?
Silver lining, certainly. Craig, I just want to come back to the one point from the BBC article. Dr. Tedros says that to date, and this is of April 2021, 0.3% of the vaccines have gone to low-income countries. Tackling that in the future, being prepared for the next pandemic, and being able to push for a faster economic recovery. It's been suggested that there might be the development of a worldwide medical supply chain to get vaccines where they need to be. Is there any merit in that? And what would that look like?
I think there is merit in that conversation. I think one thing that we're going to see and we are seeing already is that frozen drugs, frozen biologics, frozen cell and gene therapy treatments, that's not new, and it's not going to go away, because the next drug and the next cell and gene therapy and the next oncology drug, that is going to be required. So we have to start thinking about, it's very different in a country like the Netherlands or Germany, where you can go out and you can build a freezer farm. That's a term that we use, a freezer farm of a few, maybe even 100,000 square feet of space. What do I do in a country where I don't have the capital to build that? And by the way, it probably doesn't make sense. What is much more viable in the short term is a just-in-time supply chain that gets drugs or vaccines or ultra cold product from where it needs to be, from where it is to where it needs to be in time enough that you don't have to store. That's what we need to be thinking about, is how can I get the just-in-time necessity of some of these very expensive and very highly volatile frozen things in a way that we can do it without having to invest in ways that are not feasible in a lot of countries.
Craig, you mentioned there earlier, there was this sprint to the beginning of the marathon before we realized it was a marathon. And you also said, this is not new. Okay. So, freezing, vaccines are not new, pandemics are not new, but why does it feel like we were, as a global society, so unprepared for this?
Yeah, I think part of it is, well, first of all, we shouldn't be as hard on ourselves as we are in that, because think about, we're now in month, 18, 17, and we have vaccines flowing.
Yeah.
We have countries exporting vaccine now and planning very large and committing very large amounts of vaccine exports. And as we think through what that looks like for the world in terms of fighting a pandemic, next time that there is one, and there will be, how much faster could a vaccine be available? And could we even be at a position where we're able to stop it before it gets to a global pandemic by vaccinating very specific populations? And I think there's some hope on the horizon for that.
We hope you're enjoying this APCO Worldwide production. To find out more of what we do in the communication space, head to apcoworldwide.com and see how we are helping firms build back stronger.
Welcome back to Comms Life from APCO Worldwide. We're still here with Craig Arnold, Vice President of Healthcare at UPS. Craig, thanks so much for giving us your thoughts and insights on the UPS perspective on the vaccine rollout and the logistics and supply chain challenges that the world has faced over the last 18 months. It's been fascinating. But for right now, for the last segment, we want to get to know you a little bit better. So I have some more personal questions here, if you're ready for those.
I'm frightened, but let's go forward anyway.
You never know what's going to come out, do you? Okay, great. Let's start here. Your earliest childhood memory?
I don't know if I remember it or if it's just the picture, but the moon landing, I was 2.5 when that happened. And we have this great black and white picture of my sister and I, who are a year apart, both in t-shirts with the moon landing picture on it. And my parents in flag shirts standing behind us, and we're posing for a picture on that day. So that's certainly one that sticks in my mind.
Fantastic. Who was your hero or idol growing up?
Yeah, so I wish I had a more exotic answer, but it's my dad. My father was an amazing man. He worked for the Salvation Army his whole life, from right out of college until he retired, and then well past retirement. And he just gave to others through his whole life, and just an amazing man. And I would say that's the simple but true answer.
Fantastic. Anything that comes from the heart is authentic and great, and we'll always take it. One work of art that you would tell everybody to see, read, listen to, experience, what would it be?
I think I have two that come to mind. One would be, if you haven't read the New Testament cover to cover, Eugene Peterson's version is a great way to start. Secondly, if you haven't listened to Bob Dylan's album Infidels from the mid-'80s, you should spend a good couple hours, sit down and enjoy that album.
Fantastic. And finally, I love my job because
I feel like I'm part of the solution, and it very almost in a weird way has pulled together the work part, the passion part of my work with the foundation, and just what I want to do in helping other people with working in the healthcare division at the same time has just been very, very humbling, and I'm very glad to have been a part of it and continue to look forward to what I can contribute.
Wonderful stuff. Craig Arnold, thanks so much for joining us on Comms Life.
Thank you.
Thanks for listening to Comms Life. If you liked that, leave us a rating on Apple Podcasts. Send us any questions or comments on our Twitter page. And while you're at it, you can subscribe to and download Comms Life on our YouTube channel or wherever you get your podcasts from. Stay safe and be well.